of the National Institute for Communicable Diseases, epidemiologist Dr. Phuti Sekwadi, joins us tonight to talk further about this. Doctor, very good evening to you. As an expert in the field, how concerned are you at the fact that 15 people in one area have so far died of cholera?
Good evening, Tembekile, and good evening to your viewers. Well, it's very concerning. It's very concerning that there's 15 deaths reported already. Considering that cholera it's a manageable condition, it shouldn't be killing so many people if it is managed properly and quickly as well.
And at the moment we're waiting the return of samples, right, where testing is going to be done to determine the actual source of this outbreak. The possibility that this may have in fact come from tap water, as I understand it, has not been ruled out in its entirety. Would that make much of a difference as far as efforts to contain it, if indeed it was the tap water that's been contaminated?
Yeah, you are right. The exact source of the outbreak is not yet confirmed or known, but we can't rule out tap water. Usually with cholera outbreaks, in situations where you get a lot of people being affected or being infected over a short period of time, is usually because of contaminated water supply, which gets to a lot of people, or even the whole community could be using the same or getting water from the same water supply. So we cannot rule out contamination of tap water, and if that be the case, if indeed that's where the source is, the interventions will have to be directed towards that. The long-term control measures for cholera outbreaks, even for the future, is to ensure the provision of safe drinking water, access to safe drinking water, and also ensure that people have access to adequate sanitation. Those are really the main intervention that are needed, even for future, for prevention of outbreaks in the future, even not only limited to cholera, even for other diseases as well. So access to safe water is very important in avoiding situations like the ones that we are having in Hammanskraal.
Would I be right, sir, to say that the response from the officials, the authorities in this country, has been inadequate? Yes, we're now talking about a crisis in Hammanskraal because 15 people have died, 37 more in hospital, but there were already confirmed cholera cases in the country weeks ago.
Yeah, well, things could have been done better. The response could have been quicker. But there's a lot of factors that that are involved there. So cases need to be notified immediately upon clinical suspicions. When someone presents to your facility or to a clinic with symptoms typical of cholera, which usually is your very watery stools, the clinicians or the attending healthcare worker, they are required, they're actually required by law to send through a notification of cholera, of suspected cholera, and then that will initiate, a rapid investigation, which would help us really to catch this thing much earlier. But if people present at facilities and we don't get these notifications, it becomes difficult, to detect to detect things like cholera outbreaks on time. Definitely things could have been done better, but now, the team from the Department of Health and all the stakeholders that are involved are on the ground trying to make sure that, there is no further loss of life due to the outbreak that is going on in Hammanskraal.
Let's talk about detection, because our reporter Zikona Chwana was just saying at the moment that people are being told that if they suffer from diarrhea and feel dehydrated, they should immediately report to a clinic or hospital so that something is done, because cholera is still a highly preventable illness. Those symptoms, though, people could get diarrhea, people could feel dehydration or be dehydrated because of various other factors. Is there an acute difference when they're brought about by cholera?
Well, with cholera, really the main symptom would be a very watery diarrhea. Sometimes the diarrhea has an appearance of rice water appearance. That's what we normally see with severe cases of cholera, where the stool really appears like whitish color, the same color you would see from the water that you've just washed your raw rice with. And so that is really the most telling symptom. And sometimes they may be vomiting, sometimes they may not be vomiting, but very watery diarrhea. Most of the time it's uncontrolled, like it's uncontrolled diarrhea, and someone can have multiple episodes within a very short space of time. So diarrhea is the most telling symptom, and if people are experiencing diarrhea, a very watery diarrhea, and that happens frequently, they should seek medical attention. Even before seeking medical attention, especially for adults, they should ensure that they take the oral rehydration solution just to avoid severe dehydration, because that's how cholera really causes the deaths, is through dehydration. When there's there was too many episodes of diarrhea and vomiting in some cases, a person ends up losing too much fluids, and that's how they may eventually fall into shock, and that's how cholera basically kills people. So the main telling symptom is very watery diarrhea.
Right.
The water appears like the rice water.
Just finally, very briefly, would I be right, Doctor? I'm no expert, but in saying or suggesting that there may very well have been many more people in Hammanskraal who had suffered with cholera specifically, but may not have been aware because they presented with much milder symptoms.
Yes, you are correct in saying that. Usually with cholera, it's only a fraction of the people who are actually infected who will seek medical attention, who will be sick enough to need to go to a hospital or a clinic. Actually, about 80% of the people who are infected with cholera may not even show symptoms, or they may only have mild symptoms which may not require them to present to to a healthcare facility. So there's definitely, what we are seeing at the health facilities, the number of confirmed laboratory cases. It is truly, a fraction of what is actually happening in the community. And so that's how cholera is. Not everyone who is infected will have the symptoms, but even though people don't show any symptoms, even though they are not severely ill, they can still continue to shed the bacteria in their feces. If they are not practicing good hand hygiene, they can continue spreading the infection even to other people. Even though they themselves are not symptomatic or their symptoms are mild.
Dr. Phuti, Sekwadi, good to have your time. Thank you so much, epidemiologist with the National Institute for Communicable Diseases.